Everyone, I want to welcome you to Target Coding's pop-up webinar series. These are quick pop-up webinars that we're going to be doing over the next few months. They're 15 minutes. They're quick and simple, and we're going to get started right now. Today's topic is on headaches. So, there's no audio taping or video taping allowed, and just a little bit about myself before we get started for those of you that do not know who I am. My name is Dr. Marty Cobbler. I am a chiropractor. I practiced for many years, about 16 years, and about 12 years ago I started a company called Target Coding. I'm the president of Target Coding. I'm a certified professional compliance officer. I'm a certified billing and coding specialist. My areas of expertise include CPT, ICD-10, and HCPCS coding, compliance as it relates to Medicare and HIPAA. I've written many training manuals, 10 training manuals on chiropractic billing, coding, and documentation, treatment plans, compliant cash plans. Also have written training manuals for acupuncturists and physical therapists. I write articles to many nationwide publications and journals on record keeping, compliance, HIPAA, Medicare, and I'm a guest speaker at many state association conventions nationwide. So today's topic is on headaches. Welcome those of you listening on and watching on Facebook Live. We have the PowerPoint slides that we're presenting on our web-based platform through GoToWebinar. We're going to start off with some key terms as they relate to headaches. So you're going to see the word aura in many of the diagnosis codes that I'm going to be showing in a few minutes. Aura is that perceptual disturbance that occurs before the headache even begins. Patients could have confusing thoughts, have unpleasant smells, see strange lights. So it's important when you're doing your consultation to ask the patient. You can learn a lot about the patient just by asking them a few questions, especially if they have headaches, and ask the patient, before you feel the headache, do you feel see strange lights, have unpleasant smells, you feel a little confused? And many patients would say to me, yes, Dr. Cobbler, how did you know that? That's part of migraine headaches. Intractable is a term you're going to see in a few minutes. Intractable. Some headaches are considered intractable. Some headaches are considered not intractable. What's that? Intractable is hard to control, difficult to treat. Ask your patients if they're coming in with headaches. So, Mr. Jones, you have headaches. Do you do anything for your headaches? Have you tried anything? Some patients will say, Dr. Cobbler, I've tried everything. I've tried medication, I've tried massage, I've tried acupuncture, nothing helps. So this is intractable, hard to control, does not respond to conventional treatment. Find out right in the beginning while you're doing your history. Status migrainosis, you're going to see that in a few minutes in many of the headache codes. What is that? Small percentage of migraine sufferers have status migrainosis. That's a headache that lasts for more than 72 hours. Patients could begin vomiting. They become dehydrated. They may have to be hospitalized and put on IV medication. Serious problem. So here, we're going to get into specifics now. Let's first talk about migraine headaches. You see on your screen, G43.001, migraine headache without aura, not intractable with status migrainosis. Not that common. G43.101. That's migraine headache with aura, not intractable, with status migrainosis. Also, not that common. G43.019. Migraine headache without aura, intractable, without status migrainosis. And then we have G43.109. Migraine headache with aura, not intractable, without status migrainosis. So, in my practice, and most of the clients that I work with, the most common type of headache is migraine headache without aura, not intractable, without status migrainosis. Now, let's talk a little bit about traumatic headaches. Those of you that see PI patients, you're going to see patients coming in following an automobile accident. Patients are going to say, you know what, Dr. Cobbler, before the accident, I never had headaches. After the accident, getting headaches. Never had that before. You could relate it directly to that accident, that whiplash type of trauma that the patient had. So we have right here, you see on your screen, G44.311, acute post-traumatic headaches, intractable. G44.319, acute post-traumatic headache, not intractable. G44.321, chronic post-traumatic headache, intractable. G44.329, chronic post-traumatic headache, not intractable. Let's move on. Tension headaches, G44.211. Intractable tension headache, not intractable, G44.219. There's a lot of different types of headaches. Those of you that are familiar with ICD-10 coding, you look up under the headache category, you'll see many different types. I'm going to share a few of some of the more uncommon ones, like periodic headaches. You may not have ever heard of that. That's G43.C. The letter C is in the code, and the number 0, G43.C0. That's periodic headache. In children or an adult, not intractable. Some women suffer from menstrual migraines. That's G43.A2, menstrual migraine, not intractable. Cluster headaches, probably heard of that, G44.00, cluster headache syndrome. Some patients will be on medications, and the medications are causing headaches. It's a side effect. A drug-induced headache is G44.40. Persistent headaches, G44.52, new daily persistent headache. How many of you have ever heard of a thunderclap headache? A thunderclap headache? I don't remember learning that in chiropractic college, but that's G44.53, primary thunderclap headache. It's a headache that comes on, it's a severe headache that comes on very suddenly. How about this one? G44.82. This is a headache associated with sexual activity. Primary cough headache, what's that? G44.83, a primary cough headache. That's an unusual type of headache, and it's triggered by coughing, straining, maybe blowing your nose, bending over, having a bowel movement, sneezing, blowing your nose. How about menopause? Menopause, symptomatic premature menopause, is E28.31. Those are symptoms of menopause, which include headache, lack of concentration, sleeplessness, flushing. What about facial pain? Just plain old facial pain is R51. Now, I wanted to add a few non-headache diagnosis codes that can contribute to headaches. For example, cervical kyphosis, M40.292. You know that normal cervical lordotic curve? That's what you want. Some patients, you take an x-ray, a lateral cervical, and you'll see not only has their cervical lordosis flattened, but it's gone the other way. That can cause headaches, right? Yeah, it can. M40.292. Yes, I know, I'm getting some chats coming in here. Hi, Todd, how you doing? Yeah, some people, Melissa, how's it going? See, Melissa just joined. Yeah, I know, I look like an airline pilot. Yeah, some people are making fun of me. Yeah, that's fine. Sleep disorder. Patients, you know, I noticed this after an automobile accident. A patient might say, you know what, Dr. Cobbler, after the accident, you know, prior to the accident, I was able to sleep no problem through the night. Now, ever since the accident, I have difficulty sleeping. I am tossing and turning. Can't sleep through the night. Every hour or two I have to get up. That's G47.9. That's associated with headaches, right? Depression, anxiety associated with headaches. Tinnitus, absolutely. You have right-sided tinnitus, left-sided tinnitus, and bilateral tinnitus right there on your screen. Dizziness, R42. I mentioned earlier chronic or acute post-traumatic headaches. It could come from whiplash. Whiplash, that hyperextension, hyperflexion type of injury when somebody gets rear-ended. You see the codes on your screen. That's cervical sprain, which relates to ligaments, and cervical strain. Now, what type of treatments would you do on patients that come into your office with headaches? Patients respond very well to chiropractic care. So, chiropractic adjustments, absolutely. can help headaches. But it depends on the diagnosis. Make sure you do a thorough analysis, a thorough history exam. Maybe you want to send the patient for blood work or take some, do some diagnostic tests. So your treatment depends on the diagnosis. But chiropractic works well. Spinal adjustments, 98940 to the cervical region. Cranial adjustments. Those of you that do some SOT, AK, you might do some cranial adjustments. That's 98943. Manual therapy, that deep soft tissue, myofascial release, soft tissue mobilization, stretching on the neck muscles, that's 97140. Massage works great for headache sufferers, that's 97124. CPT code, massage, 97124. Acupuncture. The acupuncturists that I work with, I would say a large percentage, I would say probably 60% of their patients that come in to see acupuncturists have headaches. Very common condition that acupuncturists see. Acupuncture could be applied with or without electrical muscle stem. So there's that code, range 97810 through 97814. Excellent. We're doing a acupuncture webinar coming up in a few weeks. Low-level laser therapy, there's 97039 and S8948. And there's many, many other types of treatments for headaches. You may or may not include them in your chiropractic practice. Again, it depends on the diagnosis. There's meditation, stress management, relaxation training, biofeedback, yoga, medication, Botox, caffeine, diet, staying hydrated, exercise. Okay, Gold members, remember you have a lot of this information in the book that were sent to you. Gold members, page 41. This is the cheat sheet. This is a cheat sheet that we have for clients of Target Coding. This is our quick cheat sheet on headaches and also rib diagnosis codes. And many doctors get a little frustrated. They can't find good sacral and SI joint diagnosis codes. We have a whole list here and a whole bunch of miscellaneous diagnosis codes. We call those our comorbidities. So it's in the book. Gold members, page 41 are the cheat sheets. This is the book. For those of you that are not members of Target Coding, we have a book that helps you come up with the best diagnosis codes to improve reimbursement. The book also has a section on justifying your diagnosis code. So let's say you diagnose a patient with cervical radiculopathy, and now you get questioned, what subject of ortho neuro chiro test do you do? See, years ago, a patient would come into my office and say, Dr. Cobbler, I have back pain, I have pain down my leg. Sciatica. I wouldn't do any ortho, neuro, any tests. Sciatica. Well, can't do that anymore. Times have changed. So you have a patient with cervical radiculopathy and you're ever questioned, Dr. Cobbler, how did you come up with that? By a state board, a case manager, a malpractice case. Hopefully you'll say, well, we did some Valsalva, we did Jackson compression, a couple of ortho tests, diminished reflexes, checked for myotomal weakness, limited range of motion. So Target Coding Gold members, that's on page 178 of the book. Here's an excerpt of page 178 you see on your screen. Alrighty, so chiropractic and headaches, great combination. Patients respond very, very well to chiropractic care with headaches. So I want to thank everybody for attending. Here's my contact information. You could email me directly, Dr. Cobbler at targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. These are pop-up webinars that are going to be recorded, and they're for members only. So if for some reason you didn't catch this all, you will not be able to watch it again. We do have webinars posted on our website and our YouTube channel that are free, but these pop-up webinars are going to be recorded and are going to be placed in the Target Coding member-only section of the website, so members, check them out. And those of you that are not members, just want to let you know that we do more than webinars here at Target Coding. We do seminars all over the country. We have a whole bunch coming up. We sell videos. We do on-site consulting. We have membership programs. You could hire us even for an hour or two if you would like. We have a packet of forms, letters, and templates. We do HIPAA compliance programs and Medicare compliance programs. If you see Medicare patients, both are required. HIPAA and Medicare is mandatory in all 50 states, so might want to check that out. We also do compliance manuals on billing and coding for acupuncturists and physical therapists. There's our Medicare compliance manual. There's a photo of our HIPAA compliance program. We have a basic membership. It's $99 a month, pay as you go. No contract. There's some more information about our book. There's a whole section on frequently asked questions and our cheat sheets. Here are some of our patient forms that you see on your screen. Oh, our next physical therapy webinar is going to be on June 14th. It's $169. Very important information that came earlier this year on the therapy cap. Acupuncture webinar, June 21st. Everything you need to know about acupuncture billing and coding. Check it out. $169. It includes the live and recorded seminars. I'm sorry, the live and recorded webinar. Gold members, you know, you could attend for free. Again, here's my contact information. I want to thank everybody for attending. I hope you learned a lot. Take care, everyone. Bye-bye.